So I think one of the public health issues I feel strongly about is the fact that it's vaccine misinformation. This issue needs urgent fixing because misinformation can lead to outbreaks, which can lead to death, which also can lead to reforming of vaccines that we have long since gotten rid of. Like polio is a recent epidemic that possibly could be coming back. One thing I will say about this class, it's kind of helped me. All of these health topics have kind of given me an idea of how much understanding media shapes us as all of us in the public perception and behavior regarding the issues that we have within our health. I learned that an effective communication requires credible sources, a well-crafted message, and media strategies targeted to specific audience to promote trust and behavior changes. Now, when it comes to vaccine misinformation itself, it's often portrayed in media. While some credible outlets provide accurate information, most social media platforms are filled with so much misleading and false information shared by people who don't understand the content itself, or some doctors who have long published information that has been discredited but people still believe it. That can lead to a lot of confusion, a lot of harm within the public health itself. Based on what I've learned in this class, I would improve the media portrayal of vaccine frustration by for a couple ways. Use trusted spokesmen like healthcare professionals, respected community leaders, and to amplify correct information. Employing different media types, focus on social media platforms, especially in the younger generations, young adults, parents, and use things like Instagram, TikTok, YouTube, where misinformation often spreads rapidly. Creating a lot more engaging, relatable content, such as short form videos, testimonials, infographics to debunk myths and share a lot more science-based facts. But also, I would also like to target a lot of the general public in policymakers, such as those within the higher health fields, like in CDC and health and public figures that can help foster awareness and support for vaccination programs and policy initiatives. The main goal of my campaign is, to kind of increase public trust within vaccines, improve vaccination rates, reduce a lot more preventable diseases like, hepatitis C, polio, rabies. There's a lot of diseases and things that are easy if you just get the vaccination. I think ultimately this campaign's point purpose is to create an informed public that can discern facts from misinformation and make positive health choices. Throughout my campaign, I would rely on authoritative research such as the CDC, Prevention, the NIH. A lot of these organizations can help give you up-to-date models and communication tactics that you can use, such as CDC's whole campaigns during the COVID-19 pandemic, because they become one of the trusted officials when it comes to helping educate the public.